Hello, and welcome everyone to today's webinar, Supporting Patients and Families in Pursuit of Compassion. I'm Stephanie Adler-Yuan, Director of Education and Training at the Schwartz Center for Compassionate Healthcare, and your moderator for today's session. The Schwartz Center for Compassionate Healthcare is a national leader in the movement to make compassion a vital element in every patient-caregiver interaction. Before we begin the formal presentation, let's go over a few details about the webinar. The Schwartz Center's Compassion in Action webinar series is funded in part by a donation in memory of Julian and Eunice Cohen. Today's program will be 60 minutes long, and we'll spend the first 45 minutes on our presentation, which will be then followed by a 10-minute question and answer session. We look forward to hearing from all of you. Today's program is being recorded and will be posted on the Schwartz Center's website in about 2 weeks. So please note that as attendees, you're participating in listen-only mode, but you can interact with our speakers by using the questions pane that should appear on your screen. If you have any questions, and we hope you do, please just type them into the questions pane and send them to us, and we'll address as many of them as we can at the end of the presentation. We'll be launching some audience polls during this session as well, so we hope that you'll participate in these interactive measurement tools. And as you exit the webinar, please note that you'll receive an electronic survey that we ask you to take a minute to complete so we can capture your feedback on today's program. This is really important to us. We really appreciate it. And now it is my pleasure to introduce my colleague and our host for today's session, whom you see before you. Dr. Beth Lound is an associate professor of medicine at Harvard Medical School and our chief medical officer at the Schwartz Center for Compassionate Healthcare. Welcome, Beth.
Thank you, Stephanie, and good afternoon. Thank you, all of you, excuse me, for joining us for our 2018 Compassion in Action webinar series. A few words at the beginning here, though, about our National Compassionate Caregiver of the Year award. This award is the leading national recognition program that elevates excellence in compassionate healthcare. And since 1999, we've honored outstanding healthcare professionals who display extraordinary devotion and compassion to caring for patients and families. The award is designed to be much more than recognition for the individual honorees. The goal is really to showcase best practices in compassionate care and to elevate compassion as a core value in our healthcare system. This year marks the 20th anniversary of this award, and as part of our celebration, we've been featuring past finalists and recipients in this webinar series. So today's presentation by our 2016 National Compassionate Caregiver of the Year Award recipient, Randy Kaplan, will be speaking along with her co-presenter, Pat Masters. They will delve into the needs of acute care setting families. Acute care setting families need really two things: to be heard and to be cared for, even as they themselves take on the crucial role of caring for a loved one. Our guests for this webinar will provide exactly this kind of information. They provide these essential supports to families dealing with serious illness. And during today's webinar, Randy and Pat will discuss how clinicians and family members can work collaboratively to establish an oasis of calm and compassion in the face of havoc that illness often wreaks. So with that overview, I'm pleased to introduce Randy Kaplan, LMSW, Director of the Arthur M. Neal Caregiver Support Center at Montefiore Health System, where she supports and guides families through their loved one's illness experience. Welcome, Randy.
Thank you, Beth. It's a pleasure to be here with you today.
Also with us today is Pat Masters, a television reporter turned patient safety advocate and the founder of the Patients View Institute. She is a champion of organizational change that puts patients and families at the center of care. Welcome, Pat.
Thank you, Beth. I'm so very glad to be here for today's discussion. Thanks.
Well, we're all very anxious to hear today's presentation, so I'm going to go ahead and turn the program over to Randy.
Thank you, Beth. So it all started in 2009 when leadership at Montefiore Medical Center here in the Bronx sought to provide a way to support family caregivers. Our initial thoughts were we needed to provide a quiet, tranquil, soothing refuge to provide those caregivers with the essential and compassionate support that they needed to navigate what we consider to be the stormy waters of illness that have the power to shipwreck every and any family's emotional, financial, and psychosocial equilibrium. Serendipity is what brought me to Montefiore, back to Montefiore, I should add, at this precise moment in time when Montefiore leadership was looking to create a program to offer this. So I have the privilege of being the director of the Caregiver Support Program here at the Montefiore Health System. And even though I didn't know it, I was actually uniquely qualified for this position. And in 1975 began this journey of caregiving. I was 17 years old. My mother was diagnosed with single and days later bilateral breast cancer. She was 46 years old at the time. And I was starting to look at colleges. I was a senior in high school. My father became totally paralyzed. Honestly, I cannot really remember exactly where my sister was. She was 14 at the time. I don't know, where she was. It was sort of all the focus just seemed to be on my mom, and somehow I knew that it was up to me to step up to the plate. So everything quickly turned toward my mother's care, and the anxiety in our family system rose to great heights. I remember it vividly to this day. So there was my mom receiving extraordinary care at a renowned cancer hospital in New York City, and I was crying in its lonely and cold hallways. There was no one for me to talk to, no one to ease the fear and enormity of what we as a family were facing, and we were suddenly thrust into this without any warning or preparation, which is what happens to all family caregivers. So there I was applying to college at the time, and despite my mom's courage and stoicism, I felt scared, I was extraordinarily anxious, and I felt very guilty about the thought of leaving home. Fast forward to 2004. I'm now the mom of 3 children. The youngest is 8 years old. Our middle child is starting to look at colleges. She's 16 and a half years old. And our oldest daughter is a sophomore in college in Connecticut, and she's 19. My husband of 32 years goes to work in the morning and calls me in the afternoon to tell me that his left hand is not working. So within 2 days, he was diagnosed with a deadly and aggressive primary brain tumor. And there we were, back at Montefiore. His neurosurgeon, Patrick LaSala, looked into our eyes that were stunned and terrified, and he said, "I know you were just minding your own business." I will never forget those words because he really hit the mark. So after 2 brain surgeries, radiation, more radiation, 3 treating medical centers, vaccine trials, complications that no one had ever heard of, and a clean, no visible brain tumor MRI on August 28th, my husband died on September 6th of 2005. What I remember is that the best medicine we received as we battled the cancer beast, as Ken Schwartz put it, was compassion. The kind word, the healing touch, it can make a difference. I know it makes a difference because I experienced it. So how are we going to create this oasis where caregivers, both family and the professional caregiver, could come and feel safe, comfortable, cared for, and listened to? Well, we were lucky enough to have a model for us at a small community hospital up in Northern Westchester. So I always like to pay tribute to that hospital, Northern Westchester Hospital. They were our guiding light. And we created a space, and you can see that space. We have a tranquil waterfall. We have computers. We have 3 private rooms. We have incredibly well-trained volunteers and a program assistant that none of this could happen without her. And we have, I'm happy to say that after 8 years, we have a medical system that has really bought into it. They come to us, they send patients to us, they send families to us, we visit families, we visit patients, we have family meetings in the center. And I wanted to tell you a little bit about 3 different families in particular, maybe 4, that we've had extraordinary contact with and can truly describe what it is to receive the kind of support that we offer. First family I'll talk about is the McDonald's. They were featured in a CNN special, so I'm not giving away I'm not violating any HIPAA regulations. They are the family that had 2 little conjoined baby boys who are doing remarkably well back home in Indiana right now. And as one cannot imagine, the stress of this family having little baby boys that were about to undergo 3 surgeries up until their 4th final surgery, which led to the separation of their heads. They were attached by their skulls and their brains, which were very, very intricately meshed together intravascularly. I spent every single day with that mom and with those babies at some point in my day, just being there, listening to her, holding her hand, wiping her tears, holding one of the baby's hands while the other baby was screaming, holding one baby's hand while the other baby was seizing. It was an incredibly emotional experience for everyone involved in the care of these 2 babies. And what she said to me at one point was so extraordinarily poignant, because I didn't really know what it was that I was doing. I just knew that I was doing what I guess comes sort of naturally to me, despite the fact that I am a social worker and I do have, that kind of training. She said, I looked at you looking at me while one of my babies was having an out of control seizure that no medication was stopping. And you were wiping my tears, but what I remember the most is that your eyes were looking into my eyes and you saw me. I think that that's something that we really need to emphasize and think a lot about, seeing the other. I think that we get very caught up oftentimes in medicine with the technology, with whatever it is that we're trying to do to save someone's life, and we really forget that we're looking at people. We're not just looking at patients. And what I've tried to impart here at Montefiore is that the family is the unit of care. And I have slowly but surely sort of, made my way, infiltrated the system that doesn't always remember to think that way. That while you're taking care of a patient, and the nursing and the PAs and the NPs and the surgeons and all the doctors involved, the hospitalists, we're taking care of a family, and that patient is part of that family, and we cannot separate the two. So we had a lot of meetings where I would hear from the mother of these twins, and she would say to me, Dr. So-and-so is incredible, and I love him, but when he talks to me, I don't think he's taking me seriously. He's just so relaxed. He's so this, he's so that. So I would go to Dr. So-and-so, and I would say, you're extraordinary. What you've done is extraordinary, but let me just tell you a little bit about how the mom feels. And he said, whoa, I never even thought about that. I said, now, of course, we would never want a hysterical surgeon on our hands, who was, adding to the anxiety, but there's something missing here, and I'm here to advocate for her because I think it would go a long way. Well, he listened and he heard, and it changed the dynamic between them in a very, very powerful way. So I continued to do that on a regular basis. And in fact, there was a young woman. I'm 61 years old. She was the same age as me. Her oldest child was the same age as I was when my mother died, and I clearly was identifying with this family and with this 3 children. And she had a ruptured aneurysm that was repaired at another hospital, and she was transferred to Montefiore. And I had never seen a more dedicated daughter other than the old me that I remembered very well when I met this young daughter, who was the same age as my daughter now today. And when she needed to speak to the cardiothoracic surgeon and she didn't know how to find him, she would come to me and say, I want to know if we can try this. I don't know why they're doing this. I have questions about this. And I had a relationship with this cardiothoracic surgeon who I adore because he's compassionate. And I would text him and he would say, come across the street. I'm in my office. Bring her over. And having that ability to do that for a family member is extraordinary because she didn't have to lose her mind. She already was losing her mind. So the ability to provide the extra cushion of knowing that she had access to her mother's primary caregiver was extraordinary. And unfortunately, this mom did not make it, but the 3 children, who were all in their late 20s to 32 years old, asked me to come into the room when they knew that there were no other options. Their mother was on total life support. Their mother was intubated. Their mother was on a vent, and they looked at me and they said to me, and I'm a social worker, not a doctor, what do we do now? And I said, more morphine. I went out and got the nurse, and we gave her more morphine. Then they looked at me and they looked at the vent, and they said, what do we do now? And I said, turn it off. Now, this was after 4 months of her being in the hospital. This is not a family that I just met that day. Then I just stood with them, close to their mother's bed. I slowly backed away as they sang to her, held her hands, and they occasionally looked up at me, and I nodded when I knew that their mother had gone. I was crying when I walked out of that room. I went over to the brightly lit nurses' station, and one by one, the nurse manager and many of the others who had taken care of Mrs. M for months started to cry. We fell into a Mary Tyler huddle, and we all were hugging each other, holding each other, as the 3 children in the room only a few feet away from us held on to each other and cried over the body of their dead mom. Another family that was with us last year, this was a story that was actually in the news as well. Young 19-year-old guy was an EMT worker, loved to go fishing, loved to climb a tree, and he hunted with a 90-pound bow and arrow that he clearly described to me was not the kind of bow and arrow that you use in camp, something very different from what we typically imagine. And he got the flu. And he was brought to Montefiore, and he was on full life support, and nobody expected him to live. And the cardiothoracic surgeon that put him on the ECMO machine, that's the very highest level of life support, called me, texted me at 7:30 in the morning and said, I'm going to need your help. I have a 19-year-old kid who's going to die. That's what the text said. I still have it in my phone. Well, I met with that dad every single day for 4 months. The kid, his name is Will. I can say that because, again, he's on the news and I have permission to say it. Will is alive and well. He's been being fitted for 4 prosthetics because during the course of being on life support, he lost his hands, he lost 1 foot, and he lost most of his other leg. And so during the day, I would occasionally go up to check on Will when his dad couldn't be there, even though his dad was there every single day of the hospitalization. And one day, Will said to me, would you mind scratching behind the back of my leg? And I said, sure. So he had the partial leg crossed over the other leg. And I said, listen, Will, if your dad walks in this room and he sees this, this is your response. You've got some explaining to do because I'm not explaining this one to your dad. And he goes, well, you know, it's kind of hard to do when you don't have hands. And that dad sat with me pretty much every night after hours, crying and sobbing. He had been widowed many years earlier and saying, how am I going to do this? How am I going to do this? How am I going to do this? So being there and listening and just bearing witness is so incredibly powerful. And when we talk about burnout, I think to myself, how can we really get burned out when what we're doing is what I think is so natural? And I think it's a part of every human being. So I think about the Dalai Lama, which I do upon occasion, and there's an incredibly beautiful quote. He writes, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. So when people say to me, how do you do this? How do you do this every day? And then I tell a story similar to what I told, on this webinar today. I think what I'm doing is just I'm being the compassionate person that I was raised to be. My mother was not religious, but my mother said, all you have to do in life is treat other people the way you wish that you were treated by other people themselves. So I know what it's like to be the family caregiver and not to have that support. So I think that offering this support is such an extraordinary model of compassion, and I'm very proud to say that Montefiore Medical Center is the only academic medical center in all of New York City that offers this. And in closing, I want to just talk about one family that recently came to the center. Their loved one came, he was in heart failure, and he needed a left ventricular assist device that's a heart pump. His heart was in complete failure, and he was 72 years old. And during the course of his illness, which was complicated and had many, many, many problems along the way, a different problem arose where from prior radiation for prostate cancer 18 years earlier, he started to bleed, and there was no way to control the bleeding. And we had many, many end-of-life care discussions with the palliative care team, always in the caregiver support center, where his wife and his 2 adult children felt very comfortable, very safe, very cared for. And we finally they came to the decision with our guidance, I think, and our support that this was too much. And he, in fact, himself was asking for it to be over. The patient himself was saying, this is too much. I cannot live this way. And so I was actually at the Schwartz Center dinner, but I was texting with the family who was asking me if this was the right thing to do. And they wanted me to actually be there when they turned off the LVAD, but I couldn't promise that I could get there in time. And I stayed on the phone with them from the hotel right next to the Boston Convention Center. And I was in the room with them via the telephone. And I paid a Shiva call to them, and I actually got a text message last night from the wife, who I said she could absolutely stay in touch with me. She said, I miss you, I need you, call me when you can. So that's how we do it at Montefiore. I think that the compassion that we show is very basic. It sounds like the easiest thing in the world, because it is. And I think that all we have to do is remember that if people felt cared for, it goes longer than any of us can possibly imagine. I think that touch that Ken talked about, I think that those healing, kind words that Ken Schwartz talked about, that's what inspired medicine is. And I think that we can do it. I think that the Schwartz Center is no better model for us to follow. And there are a lot of different ways that we can really give families and create a sort of rapport with the treating team, so that families feel that we are all in it together. So those are my thoughts on the subject.
Thanks, Randy. I'll jump in here. This is Stephanie. Just first of all, thank you so much for sharing those wonderful stories. We appreciate them so very much. And I can't even begin to fathom how much your patients and families whom you care for appreciate you. So thank you for that. So I'm going to move to our first polling question now. Just to ask all of you, we saw on the slide a little bit and heard about the scope of what the Caregiver Center at Montefiore provides. So we were wondering if you could tell us what programs or resources does your organization provide to support, let's say to support specifically families, family caregivers. So please select from below all that apply. Support groups, individual and group counseling, pastoral counseling, caregiver resource center like the one that Randy leads so wonderfully here at Montefiore, and or other. Have we not captured what your organization provides? So we've got lots of answers coming in here. And this is exciting. So let's see what we've got. We see that fantastic. We see sort of topping the list here. We see pastoral counseling as being very commonly provided, as well as support groups, individual and group counseling somewhat. We see 20% of our participants saying they have a caregiver resource center, which is really exciting and really encouraging, and 27% other. So if you fall in that other category, we'd love to hear more maybe in the questions pane about what else you're doing at your institution. And thank you for participating. Randy, do you want to weigh in at all on those results before we turn the program over to Pat?
Well, I think it's great. I think all of those things really add to having a compassionate environment. So I would say just keep up the good work. And I don't know exactly what your caregiver resource center is to the 22%, but it's important. And I hope that it's in some way is more than just a place where people can go and get pamphlets. I hope it's a place where they can have somebody to listen to their tears, hold them, touch them, hug them, look at them. I mean, that's what ours is like, and I'm not diminishing the importance of what another resource center might be, but that's the kind of space that we offer. And I would encourage all of you that don't have an actual center that does what we do to seek from your leadership the ability to create one. But all of those supportive services are wonderful.
Fantastic. Thank you so much, Randy. And now we'd like to turn the program over to Pat.
Well, thank you so much. And Randy, you are so inspiring. And I bet that there's a number of people on the line here today who wish they had the type of resource that you've created there, wish they had someone to refer families to, probably have their own stories where they just had so much desire to be present and are not always given permission, or don't necessarily have such an evolved culture. So I think you probably inspired a lot of people here today. So I thank you for that. What a wonderful example you provide. So I'm going to tell you a little bit about my background. I don't have anywhere near the dramatic stories that Randy described, but my journey, as with most advocates, came from personal experience. And for 25 years, I was actually a television news reporter, an anchor, and a medical reporter at New England television stations. And my job was to go out and make sense of what happened in a given day and translate it to large numbers of people at the end of the day. And in 2005, I left. My dad fell down the stairs at home. He was an otherwise healthy 76-year-old man at the time. And he initially fractured his neck and went into the hospital after never having been hospitalized in his life to have a procedure to fix his neck. And that went amazingly well. I wrote a lovely letter to the neurosurgeon who did the work. But as it happened, my dad contracted what I later learned was a virulent C. diff infection. And 2 days after surgery, his intestines ruptured. And ultimately, although he did survive that, this cascaded into a situation which is not uncommon of infection, of setbacks, eroding his health over the next 6 months. And ultimately, although we did believe he would come home, he passed away in the middle of the night from, we later learned, was sepsis, which was complications of the initial intestinal problem. So I went on to try to make sense of this bizarre turn in my life and how I thought I might be able to have some impact for other families, because that's really what I've done as a journalist, is to try to give others information that would help them have to make better decisions, to be more aware, to be more proactive. And I didn't know at the time how prevalent infections were, so that became my initial effort. But ultimately, went from the grassroots level up to the national policy level. This is a meeting of CMS and the Partnership for Patients. I've led teams, the National Quality Forum, done some work with Robert Wood Johnson Foundation and others, really trying to look at policy, trying to move the dial on how we can essentially help patients have better experiences. I looked first at what we're doing to find out what patients' experiences are. And I know this must look very familiar to you. This is a snapshot of HCAHPS, which are the scores that hospital patients use to give their feedback. And I don't know, I haven't really talked to any clinicians who would say that this does the best job. The feedback time is 1 to 3 months. The response rate is less than 2%. It's expensive. And I don't know many people that really look forward to filling out a 6-page paper survey 4 to 6 weeks after they get back from the hospital. And it tends to be that you get a certain percentage that either have had a terrible experience, which lingers. The ones that have a good experience want to put it behind them. At any rate, I found this inadequate to really harness the experiences of patients to make it better. And then we learn along the way that, clinical options can be measured. This is the approach of medicine. It's evidence-based, it's measurement, which is its own, at this point, cross to bear for clinicians who feel they're doing a lot of measuring, a lot of data entry, and they're not getting to the heart of what they really went into healthcare to do. So although these measures should guide quality improvement, most patients don't think that way. They literally think about how a person should be treated anywhere from a restaurant to a hair salon to a grocery store to an auto place. And that becomes their standard of what an experience should be like. So they don't judge their experience against other hospitals, but against all experiences with every industry, service, and product they encounter. And precluding catastrophe, patients judge their experience by how they're treated as a person. This is a slide from Dignity Health, and it literally paints a picture of just how important kindness, empathy, compassion are to patients. 87% said that kindness is the most important thing in choosing a doctor, and 90% said they would break up with their doctor if they were treated unkindly. So this is just some sense of what we know in our hearts to be true. There's no more vulnerable time than when you're a patient, and it means so much to be treated as if you're seen, as Randy said. So trying to figure out what to do with this information, I realized that we're not capturing the kinds of stories that Randy discussed that we all have heard or have seen to some extent. And 70% of everything we learn is taught through stories that are handed down from one to the other. And I'll bet many of you on this call can tell a story, and probably what we've discussed so far has prompted something in your mind. So we set out to figure out, how can we get the whole story from patients, rather than asking for through surveys or other filters that we create for what we need to know. We invited, through our organization, Patients View Institute, to have people tell us their stories any way they want to. You could text it, you could send us a voicemail, you could write a letter, you could email it, you could send us a photo, a video. We actually got one cartoon. It was a graphic image about a young man's experience with his father's end-of-life care. And then we developed a system on the back end to identify common themes and trends, so that we could speak with a more cohesive voice about what patients are saying that they want, need, and have a right to expect. So after 1,250 patient stories, what did we learn? By a 4-to-1 margin, it's hear me, see me, listen to me. My time, my preferences are so important. Coordinate the coordinators. Things are way too complicated, so please make it simple for me so that I can follow along. There were concerns about follow-up, responsiveness, and accountability. If the nurse says something in the morning and somebody else says something later in the day, it's very confusing. All of these things leave us feeling lost and not seen. And so getting this right for clinicians is more critical than ever. And I don't diminish any of that as it's the right thing to do, but I know that all of us in our work environments are asked to make a case, especially in environments of scientists and clinicians where, okay, show me that this is important. How can you tell me that I need to assign resources to it? Well, as you all know, because you're all living in the world and read and have families and learn, technologies are disrupting everything we do. And much of that's good. Some of it's very annoying. I know nurses are at their wits' end about these big computers they lug from room to room, and they don't have an opportunity to look in people's eyes as much as they'd like to. We're figuring that out. But in the meantime, as we figure that out, as established and legacy organizations figure that out, there are new competitors who are here and really want a big chunk of the work of healthcare. Including, obviously, CVS, which has 1,100 minute clinics, 20 million patients, don't have to make an appointment, and they have a 95% satisfaction rating. And they're already getting many patients in for things like a minor illness or the flu. I've sat across from CVS folks, and they had a slide up on their wall about the range of their business, the scope of their business. It's a half circle, and they have every intention of filling in the other half of that circle. What that means, whether it's hips and knees and well baby care, I don't know, but we can be sure that they're working on those types of things. We all know Amazon, Apple, Berkshire Hathaway, Chase, Walmart. We've read these headlines as well. Apple has launched medical clinics. Berkshire Hathaway And Warren Buffett talks about the tapeworm on the U.S. economy, which is unnecessary cost. Boeing, Lowe's, Walmart, they're actually negotiating with healthcare systems, and they're tying contracts to quality outcomes. And even Walmart, for instance, will send any candidate for a transplant to Mayo Clinic to get a second opinion, where they find that oftentimes it's not necessary. But they also find that when it is necessary, when they have a bundled experience that they're willing to pay for, that the organizations such as Mayo and others will get top-rated care, because they do more of them, and they've examined their process and their approach, and they've gotten and they get a happy employee, a healthy employee who gets back to their work and their life. And empathy is implicit in creating products and services that mean we are not confused as patients. We get top care. We get people that see us and have the time to recognize us. And this is what the consumer mentality is doing as it makes inroads into the healthcare space. Patients, as we know, are activated as they had not been before. We all saw them marching in the street early last year when their healthcare insurance was threatened. So there's a degree of activation in a space where patients for so many years and traditionally have been passive and might be more likely to either comply or hear or those words we use for patients when they're told what they need to do for the course of their treatment. Patients are talking to each other, which is another huge factor. And there's not a lot of information on this slide, but I can tell you that with Facebook, ratings of hospitals posted on Facebook appear to correlate with hospital readmission rates and overall quality of care. That's from the Journal of General Internal Medicine from 2015. Twitter actually mined the phrase doctor messed up or doctor screwed up. They found there's an 83% rate of specified type of medical error and 52% frustration from patients describing this. And Yelp was found, according to Health Affairs, to do a better job than HCAHPS in rating that quality of hospital stays. And I only share this with you to let you know that patients increasingly are allies in the common mission of knowing what great care looks like and asking for it. They're begging for it. They want your C-suite to know how much this matters. Millennials are another, that slide was just a bit delayed, my apologies for that. But when we look at millennials, my kids, your kids, they are more than twice as likely to switch primary care physician in the next year than seniors would be. A third break referrals. They want to see their own specialist. They embrace virtual visits. They are looking at online reviews. They are more likely to go to retail clinics. And boomers as well. Those of us who are happy to Google things, we are not going to follow meekly in the path that our parents might have followed. So these are all factors that are impacting what the future viability of our healthcare system looks like. Physicians, not just physicians, but this is one example. Out of 17,000, half would not recommend going into medicine as a career, and half will retire or leave in the next couple of years. And that is really very frightening. And there are similar statistics about nursing, that we have to bring empathy not only to our patients, but to our colleagues, to ourselves, to each other. It is the holistic approach to ensuring that healthcare is appropriate, is healing people, and is bringing joy to the workplace. So that's a bit of my presentation right now. I'm going to actually turn it back to Stephanie to invite you to weigh.
Fantastic. Thank you so much, Pat. So much to think about. So as we've heard sort of the really quite compelling argument for why it's so important to think about support for families and their journeys, how strongly would you say your organization is committed to providing that support? So if you all could take one of the following, not all of them now: very committed, somewhat committed, neutral, or not really committed at all. So we'll give you guys all a couple of seconds to move over to your mouses and click on your screen. And that's fantastic. I am very encouraged by some of what we're seeing with these numbers coming in. So if we can take a look at the results, that is fantastic. So we're seeing 57% of you on the line, perhaps evidenced by the fact that you've all made time for this webinar today. So we are a shared values community here at the Schwartz Center. But 57% of you see your organizations as being very committed to providing support for patients and families. 27% say somewhat committed, 12% neutral, and 4% not really committed at all, which it's, to me, I'm pretty optimistic about these findings. Pat, what do you think?
I agree completely, Stephanie. And it's interesting that, so many of these opportunities, to an extent, are we speaking to the choir? But I would say we're speaking to the leaders. We're speaking to people that know how much impact this approach has in their clinical settings. And we need people like you on this call that are very committed to go further, and those who are somewhat committed to reach out and be encouraged, for everybody to move up their own scale wherever they are and connect with others that can help you get higher on that scale.
Absolutely. Thanks, Pat. So going back to your presentation for a few minutes, and then we'll have some time at the end for Q&A. And keep the questions coming. You all are fantastic. So back to you, Pat.
Great. Thank you so much. I've never run a multifaceted organization, but I have an analogy here. And to me, a system is something that is holistic. It's an organism where all the parts work together. So I have a picture of a tree here. The hard work of building a system means that if as it is now, we're so siloed in our approach to care in too many of our clinical settings. So you have one branch that works at patient experience, and another that works on admissions, and another that works on innovation. And so we have these separate branches that are all working on different aspects of care. And the reality is that there are many ways that each is supported by the other. There we go. So these are some of the silos in which we work, or different facets or products of our work that we create. So all of these are what you might call fruits of the tree. That we have safe care, we have joy at work, we have patient engagement, good outcomes, patient satisfaction, shared decision making. These are all benefits, positive signs that we're doing great work. And I ask you on the call to think about what's missing from this picture. And I can't hear you talking, so I'm going to give you a hint. It's that a tree doesn't start at the trunk there. There is a part below the tree that's missing from this particular image. What's missing from that image, obviously, is the roots. And to create wonderful fruits and a vibrant tree, to create a resonant and successful system, we need to feed that tree. When we feed the tree with a holistic approach to care, which means empathy toward ourselves, our colleagues, our patients, each other, it cannot help but feed a more vibrant, productive, fruitful tree. And this is why we need to infuse empathy into our policies, our practice, our everything we do with our patients. And I dare say, although this webinar is about healthcare, that when we work in an environment like this, where our inputs yield the best outputs because they're supported by the infrastructure, we have better families, we have better relationships, we are working in an environment that brings joy to work, which all of us so richly deserve. So empathy to me is twofold. There's the empathy about design of products and services, which is embodied by what Steve Jobs set forth doing. Apparently, he was not the most empathetic person to people, but he did understand his customers' needs. He understood that to create the best product, you have to imagine yourself in the seat, in the shoes of your client. What are they experiencing? When are they frustrated? What would they love? How can we thrill them? And that type of empathy is embedded and implicit in all well-done products and services. The other empathy is what Randy was talking about, which is sitting with someone, listening to them, feeling compassion for them, acting on the empathy, and making that human being in care feel that you are absolutely there for them. It will make a world of difference to them and to yourself. And I can share with you that from everything patients have shared with PVI and all the policy work I've done, we are all eager to reward those who meet those needs. Thank you very much.
Well, thank you, Randy and Pat, so much for those really meaningful and comments. I'm sure that our audience has, and as a reminder, I just want to let you know that you can still type in your questions into the questions pane. We'll answer as many as we can in the time remaining. We did get quite a few questions, and I think I'd like to ask the first one of Randy. We had one question about how you actually get organizational buy-in to start the kinds of resource centers, family and support centers that you did, where so many organizations are trying to cut back on costs of care. How do you get institutional buy-in to the need for this kind of resource that you supply, Randy? Perhaps Randy's not able to.
Muted. Okay, I'm here now. Well, I was very lucky. I was very lucky in that my organization actually was seeking to do this, but since then we have, because we sort of showed that it was such an effective way to help the entire organization, we have opened 2 additional caregiver support centers at 2 of our other campuses. One is our second largest hospital, and another one is a smaller community hospital. And White Plains Hospital, which is currently under the Montefiore umbrella, has had one for quite a few years. And Burke Rehabilitation Hospital, which is the first rehab hospital in the United States to have a caregiver support center, their current CEO once worked at Montefiore. And so I think it was seeing the model itself when he was here, and many conversations that I had with him, it was sort of a no-brainer where a donor came along and said, what can I do to, give my money to the hospital that did so much for me? I think that if anybody has access to leadership in their hospital, they should call Dr. Safir. That's really what I would tell you, is that, we have proven that we are a compassionate organization and that we serve an incredibly underserved population. And I think that between what Pat just spoke about, and I think about, what the Schwartz Center stands for, if your organization is looking to do better in any shape, way, or form, just talk about what caregiver support means to an organization, a health system at large. The physicians come to us. The staff comes to us. It's not only the families that come to us. Everybody needs support in the mission of better and compassionate healthcare. And so I would appeal to whoever it is, up that chain of command, that we can do better, and this is how we can do better.
Thank you. We have other questions here that I'd like to field a little bit, but thank you for that, Randy. Also, I just want to remind people that we use caregivers in many different ways. And when we talk about caregivers at the Schwartz Center, we're usually talking about anyone who touches the care of a patient or a family member in a given healthcare facility, the provider side of things. And when Randy talks about caregivers, talking really about the family and loved ones of patients who are supporting their beloveds. So sometimes that gets a little confusing, so I'll try to be specific about that in the conversation here. But we also got a question, and Pat, I wonder if you can just sort of muse on this a little bit about how to help the sandwich generation who are caring not only for their children but for their parents as well. And are there any stories that you encountered in your work that really shed a light on this growing
Oh.
issue.
Well, I've been there myself. I think probably many of us have some experience of what that's like, and I think what gets us through, what got me through, was the community of my immediate network, but also online. There's so many resources, and sometimes you just need to vent. Sometimes you need advice. But I think what all of us really benefit from is somebody with some degree of knowledge about that's been in those shoes before. And this is one thing where I'm not sure we'll ever have formal help, outside of the organizations that dedicate themselves to providing answers. But to me, you have to find a friend, somebody you can be honest with and decompress with, and research. So between the research, which helps you find the best answers, and the support you have when you can't handle it at all, you're not going to implode, and also to be kind to yourself, because these stresses are they're some of the toughest you can handle. You're supposed to be at your child's performance, but your elderly parent had a setback at the hospital, and that's just a very simplistic example of a time constraint, never mind all the other issues. So my find a friend and be kind to yourself, and take things off your plate as you can, whether it's with I don't know, finding somebody who can take a task off your plate. On a systems level, I think we're all just looking for those answers. Life is messy, and that's why having somebody who listens compassionately, somebody who can have empathy for you, can be the best medicine of all.
Absolutely. And, it's so interesting, too, because everything that you're talking about, that family caregivers need, clinical caregivers, providers, staff need as well. We all need to be compassionate with ourselves. We all need friends, and we certainly need social support. I'm just sort of very interested in the literature on resilience. And one of the most important factors that supports resilience is social support, just exactly what you're talking about. And the Schwartz rounds, of course, provide that kind of support for those on the front lines of care and staff members at any given facility, where anyone really who is involved in care can attend the Schwartz rounds. Provide that kind of support.
And Beth, I would love to know from, and obviously the folks weighing in, and not right now, but in future, the solutions that you folks have found, the inroads you have found, sharing those approaches and those successes and those best practices is how we're all going to learn. So I hope that this will work in reverse as well, that we'll learn from all of you what you've been doing that's been successful.
Yeah, absolutely. I think that's a really fantastic comment and idea, Pat. So we will think about that a little bit more. We're getting so many questions in here. I wanted to, there have been a couple of questions, Randy, these are going to be for you, about how chaplains fit into the caregiver. So how do chaplains and spiritual care providers fit into the caregiver support center? Where do they fit?
Well, people often come into the center and they want to know where is the chapel, which is next door to us, and they often say, we'd like to speak to a chaplain, a rabbi, a minister. And so we have the cell numbers of all of those different denominations. We also have an imam here at the hospital. And so we are able to, call upon the chaplaincy whenever a family would like that. And we often actually have, if the family is interested in it, and sometimes they are, we have had prayer circles right in we have a larger room in the center, and we will often become a part of the family's prayer circle. And so and part of the training that we did with the volunteers when we first started was that we had the chaplains, various denominations come and speak with the volunteers so that they understood, what the chaplains could offer, how spiritual care is so important in helping a family and a patient get through serious illness. So we are very, very integrated with the chaplaincy, and they are very, very much a part of our program.
That's great. That's great. Randy, how do you train the staff that works in your center? I'm not sure how many faculty or staff you have actually, but how do you recruit them? How do you onboard them? How do you train them? Can you comment on that?
Sure. We have a volunteer and student services director, and she does the initial screening when people come to the hospital to volunteer. She will make an assessment whether or not that person might be a good fit with the Caregiver Support Center. And if she thinks that they are, then I will meet with them individually and make a decision as to whether or not I think they're a good fit. So now we have people coming in, individually. In the beginning, we had the luxury that the center had not yet been built. We knew where it was going to be built, but we had 14 willing and able volunteers who came from all walks of life. They were all fairly recent retirees. And so I developed a training manual, and I did about a 10-week, 2-hour each session training with them. And we talked about active listening, boundaries, empathy, depression, some familiarity with different medical terms, not training them to become therapists because we're not a therapy center, but just really, and a lot of role playing about what it was to be present, how we listen, how we don't have an agenda, the importance of being non-judgmental, people are people, really trying to create a sense that when someone walks in the door, our job is to invite them in and make them feel comfortable and do a very quick sort of a body scan, if you will, assessment of, are they making eye contact? Do they look like they want to be touched? I mean, literally some people walk in and they're in tears and they just want to be embraced. But we don't know that. We have to make that, we don't want to make mistakes. We don't want to touch people that don't want to be touched. So we spent a very, very long time talking about all of those things. And we're constantly evolving and debriefing and talking about the people that do come into the center. So it's a learning process that doesn't ever end.
Yeah, for sure. Thank you. Helpful. We only have time for, I think, one more quick comment or question. And Pat, I wanted to ask you to comment a little bit more on the use of technology to help people communicate, to share their experiences, to share their stories, to share their wisdom. I know you know a lot about that. I wonder if you could just shed a little light on that. And Pat is...
Oh, sorry. I'm sorry about that. The University of Utah healthcare system started going completely public with their patient feedback online. And there was a lot of nervousness about it, but ultimately everybody's embraced it. The success has been so huge, and the traffic to the website's so great. Physicians have actually embraced it. They've actually gotten raises. I know Northwell Health has done the same. We have yet to have a reliable, comprehensive feedback mechanism for this country. And I know that the UK has done it with iwantgreatcare.org. And that was started by a physician in 1998. But I would say that until you have real, meaningful, authentic feedback from your patients being fed back into your process, until you do that, I've heard that called the smoke detector for safety in your hospital. And not just safety, but obviously the culture and the warmth. That is the single biggest thing I think we can work on to ensure that that the approach we're using with our patients is going to make us successful and viable and competitive in the future. So, and I would bet that Randy's people that have come through Montefiore and have had the benefit of that program there will never forget how meaningful that was, and they've earned raving fans for life. And I absolutely think it's possible. So all we have to do is clone Randy, and we're good.
Or spread the model.
Right.
Okay, well, we want to thank everybody for participating in this webinar. Thank you so much, Randy and Pat. And that's going to wrap up our question and answer session. So I'm going to turn things back over to Stephanie to wrap up the program.
Great. Thank you so much, Beth, and thank you, Randy and Pat, for sharing your experiences and your insights with us. And thank you, everyone in our audience today, for setting aside the time in your busy days to participate in this webinar. We hope you enjoyed it. And this was the sixth and final webinar in our series of 2018 Compassion in Action webinars, which have focused on our phenomenal NCCY award recipients. On that note, we will be posting shortly news of our next webinar on our website, which will be held in January. And we will also be opening nominations for the 2019 NCCY Award in February. So if you are on the Schwartz Center's mailing list, please keep an eye out for that. Again, please take a moment to complete the survey that you'll see when you exit today's program. We'd love your feedback. And that wraps it up for us. So thank you very much and have a lovely day.